The rate of late stage diagnosis in our state is far too high. It's too high for people over the age of 50, and it's far too high for those under the age of 50. And we need to address that. The Fifty HealthCheck Program is a CDC-funded colorectal cancer screening program. Now, we pay for the screening for uninsured patients in Arizona. We use a FIT test, which is a fecal occult blood test, and it's a very technical test now. It's not like the old guaiac test. It's greatly improved. That's the first level of screening, and then the second level is a colonoscopy.
Okay.
If the fecal occult test is positive, then we move on to the colonoscopy.
One of the most important parts about the colonoscopy is fully understanding the preparation that you need to go through before the colonoscopy. The most important part of a colonoscopy is being cleansed the evening, night, or even early morning before the test. And the preparation selection will be between you and your physician, but specifically the whole day before you're on clear liquids, and then the night before you'll do a preparation to be cleansed. And then after being prepared for the procedure and meeting with the physician, you'll then be taken back to a procedure room. And then in that procedure room is where the colonoscopy would be performed. You'll be given medicine, your vital signs will be monitored on a continual basis, and then in about 20 minutes after a colonoscopy is completed and all the paperwork is done, then you'll be in recovery.
So it's a good exam, it's a good screening tool. And these nightmare scenarios of getting a perforation or having a problem like that, they're rare. They're exceptionally rare. If they weren't rare, we wouldn't be recommending this as a screening. It would be, it wouldn't be recommended as a screening procedure because it wouldn't be safe. But it is a very rare event, and it's a very safe thing to do.
I was kind of noticing some more abdominal pain. Okay, well, it's irritable bowel, you know, we're good. So I let that go for a few months. And finally, it was getting a little bit worse, so I actually called my doctor, made an appointment, didn't try to get in right away because I didn't think anything, you know, I'm sure I just need to go back on my medication because that had gone off when I became pregnant. The pain just got more and more intense. So I called my husband in Washington. He said, go to the hospital. So I'm bouting with, do I go? Do I not go? Because I don't know how long I'm going to be there. I'm still thinking in my mind, irritable bowel. I can't imagine anything else that it would be. Ulcer, I mean, you know, just something that they can treat or you can adjust from your diet.
I was having some minor stomach disturbances, and I decided, you know, I can't keep dealing with this. So I decided to try to get into somebody that day, and I couldn't. And I thought this isn't something I should ignore, so I went into an ER, and I sat there for a very long time, 6 hours or so before I was seen. And they indicated at that time it sounded like I might have a case of colitis or something of that nature, but thought we should do a CT scan just to be sure.
The next day, the surgeon came in and had said, my colon intussuscepted. Okay, I'm still not worried. We can fix this, you know, okay, great. And then he proceeds to tell me, I can't believe I'm telling you this because I'm sitting in this hospital bed at 35 years old, healthy, no high risk, no red flags. He says, most likely it's colon cancer.
And so I was very shocked when a young doctor came in and told me that it appeared that I had cancer and that there seemed to be a large mass in my colon. And they'd also observed some spots on my lungs and were nervous that it had already advanced. And so they did some tests and sure enough confirmed that I had stage 4 rectal cancer at this point.
You know your body better than anybody else. And if you're eating the right foods and doing the right things and having, you know, exercising every day, you're healthy and there's just something a little bit off. You should go in and ask your primary care to refer you for a colonoscopy.
There are people that have symptoms already in the community. Symptoms they've been living with, symptoms they've been ignoring or trying to ignore, such as blood in the stool, irregular bowel movements, that sort of thing, pain in the abdomen, bloating.
So I think that it's important that we not let embarrassment or concern of embarrassment result in unnecessary pain, suffering, and even death.
If someone has symptoms, get screened. If you don't have insurance, that's not an excuse. Go to fit@50healthcheck.org and look up the program. It provides the phone numbers for where to call to set up an appointment.
What makes the Undy 5000 so unique is we happen to be different than your typical 5K run walk. Undy, of course, is first part of it. The 5000 is a 5K
Right.
run walk. But instead of giving out the basic, what do I want to say, boring T-shirt, we happen to give,
Right.
oh, you have them.
I have
see
them
you
right
have those.
here.
We happen to give out a very classy, custom-made boxer shorts, which when you register. So we're trying to draw awareness and prevention, and that's really what the event is about.
It seemed like a fun event because I never heard of an event where you could actually wear your undies outside of what you were running in.
And it's right in the city streets of downtown Phoenix. Close off all the streets, and everybody comes down. It's the Undy 5000, so you're more than welcome to wear your underwear, hopefully on the outside of something else.
It's a family fun event. Come in your Superman whitey tighties.
It's a great event. I mean, I love to be involved. I mean, this is such a unique event, not only for our valley, but for our state and for our country. It's unlike any charity event that I've ever been involved with, and it's been so nice to see this event just from the very beginning grow each and every year.
There's just no words to describe how important the Undy 5000 is.
How about we do this, ladies and gentlemen? The Undy 5000 2013. Who's ready to kick this disease in the ass? Go!
My mom was diagnosed with advanced stage colon cancer, and it became a totally different meaning because I come from a very small community in Arizona where our support group was each other. Within my family, that was our support group. But at that time, I decided to do the Undy, and it opened up a whole new world to me. I met a lot of different people that were survivors, that were caregivers, and that became a great support group for me. I participated on the team that year, and it was uplifting because I felt like I was running for my mom.
Hi, my name is Michelle Bobadilla, and I am representing Team Trisha, and we are here today to honor my aunt's memory. And she lost her battle to colon cancer in August of 2012. We love her and miss her so, so much. We love you, Tia Trisha! Yay!
My name is Britt Ochoa, and we are Team Britt.
The fact that I just wanted to be with other people who were going through what I was going through. The very first Undy 5000 here in Phoenix took place in 2008. I had been diagnosed a few months earlier and attended the first Undy 5000 in a wheelchair. I was 3 days out of my chemotherapy and didn't have the strength to walk from the car to the registration table, but I was going to take part in that event, even if it just meant walking around and looking at the booths or cheering people as they cross the finish line.
I've lost a couple of uncles, a couple of cousins. I've had to go through early screening. It's easy. It's simple. It's something that everyone should do if it runs in your family. So I do have a personal connection. I also, unfortunately, lost a great friend of mine in college, way too young. I lost a brother-in-law to this disease on my wife's side. So it's just something that I can personally tell people, look, this is something that you have to talk about, first of all, and you just have to take care of.
For me, it's a deeply personal experience. It gives me the opportunity to bask in the warmth and the glow of the success of those people I love who are afflicted with this disease. Blessed are the caregivers.
It's a fun event, and when you've gone through all of this chemo and radiation and being sick and not having energy, it's fun to have something that you look forward to that's upbeat, and that's what this event is. It's kind of a lighthearted way to bring some much-needed attention to a disease that's in the dark.
Having an organization like the Colon Cancer Alliance available to us as patients is essential. It really helps us to know that we're not alone. It helps us to know that there's an organization out there that's advocating for us, that's making sure that people get screened early, that making sure that there are people out there who are touching base with other survivors and using our experiences to make the next person's journey a little bit easier. It's also nice to know that CCA is working with government agencies to increase the funding for screening, for research, for development of new chemotherapies and new treatments, so that as those of us that are living longer with this disease have those options available to us, so that we can be here to do things like raise our kids or remain productive members of society.
It does a lot for what we do at the Colon Cancer Alliance on the prevention side. We also fund cutting-edge research.
Yes.
And then we also provide a number of extremely high-quality patient support services. So it helps on our 800 number, our website that we have, some of our national Dress in Blue Day, and a number of different programs we have that can be found at ccalliance.org.
It's a really wonderful place for people to go and share their experiences. And why it's so important to share your experiences is we recognize that many cancers are related to each other. And so, for example, if you have breast cancer, you have a 1.5 increased risk of having colon cancer. So even if you're 40 years of age and you have a breast cancer, you're more likely to have colon cancer. So you really need to be screened at the age of 40, not at the age of 50.
It was the best thing that I think I've ever done, because now they're like my second family. They've been through it, they're going through it. It's just comforting just to be around people who you can share your experience with.
For me, it's a way to all unite and to bring attention to a cause that doesn't, in my opinion, receive as much publicity as, say, breast cancer, because my aunt she is actually now 7-year survivor of breast cancer, and that cancer receives so much publicity and so much support, and I really felt like this is a way for all the families impacted by colon cancer to get involved and to come together.
Many, if not all, the teams are formed around a central person fighting the disease or in memory of that person who lost her life to this disease. So what's special to me is to see that love, that passion, that energy dedicated and wrapping around a specific person in support or in memory of on a single day in time when we're all in the same place for the same reason.
I met the most amazing people. It was the first time in my life that I didn't feel alone in my diagnosis. It was the first time I had ever met somebody else that had been diagnosed with colon cancer that was my age. And that was essential. That made me feel so strong and so capable, and it gave me strength to keep fighting.
One of the other sides we see that is unique is we get individual corporations will participate on the wellness side. Companies will come out and say, this is a great thing we want to support. Our employees should get screened. It's a great way to get them in front of screening. Maybe they're not as afraid to see about it when they see a bunch of people running around in their underwear and people being so open and at the health fair and talking about the different types of screening methods, the different types of treatment if they were to have it, the different types of prep that are out there that a lot of people don't like to talk about it. But we find a way to get that all out in the open and really talk about it. So we're starting to see more and more of the corporations get involved because they want their employees to talk about and get screened.
We're thrilled to be here. Stop Colon Cancer Now is a national initiative that tries to connect patients to local facilities and gastroenterologists in order to be screened. And we thoroughly support the Colon Cancer Alliance. This is our 3rd year attending the Undy 5000, and we think that it's critical to the prevention of this disease, which is in fact almost entirely preventable if patients would simply get screened.
And each person that participates is going to go out and talk to 2 or 3 or 4 people. So the bigger the team, the more the word gets out. The other thing is everybody comes to you when you've got something like this and they want so badly to help, and there's really nothing that people can do other than just love you and support you and remind you that they're there and give you prayers and love and caring and concern. But that doesn't feel like much to people. They want to do something, and so this is a way for my friends and my family to do something. And I tell them it is in support of me, and also hopefully will prevent this from happening to someone else.
Be amazed at how many of your patients, I go to the event and hundreds of my patients show up, and it's really rewarding because they come up to you and you realize they're living their lives and sharing with their families and enjoying life again.
So if you're a non-medical corporation, you could use this event actually as team building, wellness, camaraderie, competition.
Oh yeah.
All sorts of things.
Yeah, and we're seeing that more and more. Companies are taking advantage of that and saying this is a great event, it's fun, and it also saves lives. 1 in 20 people are personally touched with colon cancer, which is terrible. So normally there's even someone in their company that is, hate to say it, recently passed away or might be newly diagnosed or a survivor that they can all rally behind and show that, yeah, we need to get screened. So we're seeing more and more of that. And it's a great venue for that also.
Good morning. This is Rose Tanakungva from the Hopi tribe, and I'm the case manager for the colorectal cancer screening program. And these are part of our staff that work under the Hopi Cancer Support Services, and we're glad to be here. Go Undy 5000!
The Undy gives you the opportunity to know that there are other people going through exactly what you're going through, and there's a sense of camaraderie and a sense of survivorship and strength that goes along with those people. You're not going to get that in very many other places. That's what makes these events so special.
Hi, I'm Mario Medina. I'm with the University of Arizona Cancer Center, Dignity Health St. Joseph's here in Phoenix. Our mission for the Cancer Center is to prevent and cure cancer. We're here today to support the Colon Cancer Alliance and the Undy 5000 as part of our support for colon cancer prevention and awareness.
Join the Undy 5000, be a part of something that has affected so many lives, and others that are continuing to battle this disease that doesn't have enough awareness out there for others to learn from, just to gain the knowledge and the support and have fun with it. We can also have fun with it. But just with my personal experience, it's, why not learn and spread that awareness to save lives?
Boy, I can't believe another Undy 5000 here in Arizona is in the books. I mean, look at this place. The state capitol is not only alive with people, but it's alive with spirit. I think the Colon Cancer Alliance chapter here in Arizona has really, in the last 5 years, has laid the groundwork for an amazing race. I think people are really starting to get the message. And the best part about it is they're passing the message along. They're telling their friends, they're telling their families that this disease is beatable. This disease can be beat if you get early screened. We've got the State Department of Health behind us, making the word out all across the state. And I think the momentum is building right here in Arizona.